ask some questions of you guys, since you don't put a lot of questions into the chat when we're doing these Q&As. The Q&A is for you. So I thought I'd turn it around and ask some questions of you guys. And it would be great if you just, whether it's the current project you're working on, or even if you have some Catalyst alumni and coaches, if you remember from any of your projects answers to these questions, it would be great to have them. So my first question, after I say hi to Peter and Janice and Lupita. Hello, 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 hello. Great to have you guys here. My first question is, post one of your top 10 stories from a project in the chat. That is, for all the Catalysts who are doing their project now, post one top 10 story, like one insight you've had so far, something somebody said, a realization, a reframing, something that is sticking out as an interesting aspect of the project that's going into how you're framing it and how you're thinking about directing the solution. So that's our first question. Post one of your top 10 stories in the chat. And hopefully one or two of those will come through. And I can tell that I have to wait the minute or so for you guys. And why don't I post 3 questions? Because I have 3 questions here. So the second one is, and I'm going to make myself a little bit smaller here. The second one is, whose journey are you mapping in your project? You may not have done it yet. You may have started. You may have thought about it. But whose journey are you mapping? And then our third question is, who are you designing for? And what is one of their key needs? And that may be the same person that you're journey mapping. So one of your top 10 stories, or whose journey are you mapping, or who are you designing for and what was one of their key needs, or what is their key needs. Remember, people like Kathleen, Superstar Catalyst, you can answer too. Remember from your project at West County, answer one of these questions or what you're working on now. So this is the audience participation section of the Q&A, and I'm asking you questions, hoping that you guys will respond. Awesome. So Veronica's first. And they are doing the Promotora's journey. Nice. So you guys are trying to improve or increase the advocacy in the network, in the Promotora network. And so understanding their journey and where you might be able to fit in training, advocacy, learning, examples. It'd be great to have that journey so that you better understand their experience and how they can build up to advocacy skills and work in the community over time. I love it. That's great. I know there's more people that are watching. This is audience participation. Oh, I looked you guys straight in the eyes, and a few of you dropped off the stream. You're like, oh no, he's not calling on me. This is great. So top 10 story, or who you're designing for, obviously for Vision y Compromiso. The Promotora is the person they're designing for. Okay, you know what the questions are. You post them while I move on and continue our content. So this Friday we have a work session, so I wanted to share with you what we're doing. And you're going to be working on synthesis in tomorrow's work session. So you're going to be working with your team for 40 minutes. This is to give you guys time to synthesize. And the whole idea is to take one of these things that is the early synthesis that we have, your top 10 stories, a journey map or persona, even an information structure. If you have a lot of quotes from your users that you've put on a board, you could create one of the structures. And that's what we're doing now. I have awesome stuff coming in here, so I'm going to pause and say, Veronica said yes, and unlearning to relearn. So that's interesting. I'd dig into that a little bit more. Who's unlearning and relearning? You guys or the promotores themselves, etc.? That's great. And Norma also on this team. Shout out to Visioning Compromiso. They do have the biggest team, but you guys are always here. Appreciate that. Norma, one of your ahas was how the promotores see advocacy. Interesting. Yes. And it would be great to know a little bit more about what insight you have about that. How do they see promotores? How do the promotores see advocacy? If you could give me a one-liner, that would be great for us to learn. Kathleen, pre-COVID, way back in 2014, way back, I worked on engaging patients in the waiting room, yes. Those were the people coming to the waiting room that you had to better understand. I remember interviews, I remember you making prototypes and sharing that with them. Nice. Okay, we got some more coming in. This is great. Veronica says, yes, we are. We're relearning. That's nice. At least she is. I think if anybody goes through their project and isn't relearning something or seeing things with new eyes, you're not being honest or open enough with yourself about how you understand the world and how this kind of work can open up new types of seeing and ways of thinking and opportunities. That's what I love about this work so much. Like, I've never done a project where there wasn't surprise, excitement at the new stuff we've learned, the opportunity that new understanding and insight provides your organization for approaching the solution in a different way that's potentially more effective, more highly adopted, and more collaborative and meaningful for the team and the community. So that's why this work is so important and so effective, is that you're always getting stuff like that. Lupita. A promotora shared her vision for the future about advocacy. She wants to see communities and organizations in tune, working together, sharing the same passion for service and the same commitment. Nice. Isn't that awesome? Sharing their vision. That's awesome. And then let's get to work. How can we get the communities and organizations in tune and working together? I love that, because that's what will, a powerful community organization, one that's looked up, and I'm on the board of one here in Chicago on the west side. And when you have an organization that's well respected, there's so many things you can do to bring people together, to foster new initiatives. That's really awesome. Thanks for sharing that, Lupita. Nice, you guys are doing a great job. I want to go back to my more blanker story, or blanker slide. Serene says, Serene, welcome. At first, our team was following the patient's journey through food distribution events. We have since changed that focus to health plan sponsors, providers, and patients. Yes. So you may have expanded it a little bit, but I can tell why that is because you're trying to make the case that health plans, food distribution is a health issue, and you want to prove that and hence unlock reimbursement dollars for this. So you certainly will need to be gathering data from the patients and how it may impact their lives, and of course, interviews, absolutely. But the health plans and sponsors, fantastic. I would absolutely be interviewing them to make sure, to see how they currently see that, how they currently see food distribution or food as a health issue, and maybe ask them questions like, can you talk a little bit about why prescriptions for healthy food might not want to be reimbursed by a health system, and that would be great. That opening up those kind of conversations would be great. And here's the second part of your sentence. To better understand in what ways food distribution events are impactful. Exactly. So quantifying and characterizing that impact. And what's going to be so powerful is the last phase of this project for you guys, where you learn a more effective way of presenting a case for support. And you might not solve the whole problem in that presenting that case, but the way we help you present it usually means people in the audience are or people who are listening to your presentation are ready to help. They ask, why aren't we doing something? Why aren't we moving on this? And you get forward momentum. Nice. Oh, you guys are doing great talking. This is awesome. We have done a lot of work in advocacy with the promotoras for many years, and sometimes we need to stop and re-ask the question to evaluate if it is seen from the same perspective and has it changed. That is correct, and I guarantee you it has. But you'll also have to get, there's probably a comfortable relationship, as you say. We've done a lot of work in advocacy with the promotoras. If you've done a lot of work and you're not seeing the kind of results you want to see, then there's some sort of comfortable relationship there and comfortable way of interacting with each other that aren't moving the needle forward that you'll have to break through by digging deeper, asking more questions and waiting for that awkward pause, being vulnerable with them, and really getting them to speak up about what the real deal is in the community and what they really think. And the vision from the one promotora sounds like it's great to hear. I would ask her immediately afterwards, what's stopping that vision from coming true? And hold nothing back. Make sure you're telling us everything you really think, even if it seems critical of our organization. We would love to hear that. That's the way you really unlock new information and content. It's not necessarily easy, but it's one of the roles we played throughout all of our innovation projects, is to make the sponsoring organization vulnerable and open to criticism and open to the real information. It always delivers great information. Nice. You guys are getting, sounds like you're getting good information from your interviews. That's great. And Maria Elena is here. Greetings, everyone. Greetings. How are you doing? Nice to have you here. Okay, people have been sharing answers to our top 3 questions. What's a top 10 story from your project so far? Whose journey are you mapping? And who are you designing for? Or one of these stakeholders you are designing for? And what is one of their key needs? Those are our questions that I'd love for you guys to share answers to while I'm sharing this. So tomorrow's Friday work session, let me talk a little bit more about this. It's all about synthesis. You guys have been gathering information. You've been talking with each other about what your project's about. You've been presenting to other teams and sharing, like, we're working on this, and you're getting good feedback about, you need more clarity, what are you really focused on? And now we're far enough along into the project with some information and research and interviews that it's time to synthesize some. And we always do this in an iterative fashion. And synthesizing is the best way to understand, well, what do we think now? We're 6 or 8 weeks into the project. Let's put some stakes in the ground. Doesn't mean we can't move those stakes, but we're going to put some stakes into the ground and show somebody else what we're thinking in terms of synthesis, in terms of narrowing. So there's a very big concept in human-centered design about divergent thinking and convergent thinking. And so this is convergent. This is, we've heard about all this stuff, but you know what? We think these things are important. And so you're going to have 40 minutes tomorrow to work on that. So you should consider with your team, are we going to work on our top 10 stories? Are we going to make a journey map or a persona? These are all sketches. These are all mock-ups. These are all the first iteration. You're going to do it fast within 40 minutes, or actually 30 minutes or 35 minutes, so you can prepare to share it with another team. You're going to use a collaborative cycle and Miro. You're not going to sit back and just talk and discuss. There's too many teams when doing this work is they fall into that mode of just discussion. Nope, tomorrow you're going to make something. You have to have something to show that you made in the live work session. Okay, so we're going to be practicing that notion of mocking up, prototyping, synthesizing, making something fast. It's going to be imperfect, but then you're going to share it. And then you're going to spend five minutes of that 40 minutes preparing to share with another team. So then we'll do the feedback round like before. We're just going to do one team tomorrow, give you the bulk of the time to work with your own team, and then share with one team to get feedback, right? So team A would share with the other team. Team B zooms into their board. I've created a new global feedback board. That worked really well. Let me, in fact, let me pop over there. And that's the new one. Here's the old one. Not the old one. But you guys saw this. Like, look at all this content and feedback that you get by sharing your work for 5 minutes. Isn't that awesome? Have you gone back to this board and looked at some of the I wish, I wonders? Especially the I wish, I wonders. Those are the feedback that give you some inclination. So I've created a new board. We'll share that link with you tomorrow where we'll be putting feedback on. And then you'll open that bulk sticky note. I'll go over this tomorrow. Team A shares what they created. Team B shares I wish, I wonder feedback on your journey map, your top 10 stories, etc. So it's a synthesis day, okay? And then you guys will switch. Then we'll come back together you'll let us know how it went. And the hour and a half will be consumed by amazing creativity, synthesis, and great collaboration among your team. Okay, so I'm wondering if Joanne is around from Mendonoma, if I'm getting that pronunciation correct. It would be great to have, she was going to call in. I'm wondering if it might not be working. Joanne, put in the chat if you haven't been able to click into the interview mode to join the live stream. But do you guys have any questions about tomorrow's work session or the things I shared here? Okay, Joanne, nice. She is here. Whoops. I'm working my two computers. Copy link, paste link. Can you click on that link, Joanne, when you see this message? And we'll see if we can't bring you in. Okay, so if anybody else wants to, oh, there you go. Nice. Okay, welcome. Hang on just a second. We'll do this. Hey, Joanne, how are you?
Hi, I'm doing well. How are you?
Good. Thanks for joining us. Appreciate that. So this part of the live stream, we have Joanne from Mendonoma Health, and she's going to be sharing a little bit about their project, and we're just going to talk about how the Catalyst experience is going and what they're learning, and give you guys 10 minutes of that kind of share. I really appreciate you, Joanne, joining us. Why don't you give us just a super quick background of yourself and then the project topic, and then we'll go into kind of like what you're learning.
Oh, sure. So I'm with Mendonoma Health Alliance. I'm a community health worker. We are in a extremely rural community that serves southern Mendocino County and northern Sonoma County. Nice. And our main project here is to expand recovery peer support services. We have a very high rate of addiction in our area, particularly opioid addiction. And we've done some needs assessments in the community that really stated that peer support is something that's really lacking here. Definitely just lacking, something that we need to improve.
Nice. So that's awesome. It's great work. Thank you for dedicating your talents and time on that project and during Catalyst. That's fantastic. What are you learning so far at a high level about peer support in Mendocino and maybe why it's not there?
The why it's not there has been tricky. I think it's there are options here, but people don't really know about them. Okay. And there were options that were here before that are no longer here, and I haven't been able to find out why they're not here anymore. I had multiple interviews with people in long-term recovery that mentioned this one sort of program that they went to that was highly supportive and they loved it, but it's been gone for about 15 years and we don't know why. It may have been a court-ordered thing. and that's why it went away, just like maybe the money and the resources dried up. But I
Yep.
really want to look more into that program because they seem to really, it offered more like supportive services for activities outside of just a meeting or or a phone call.
Nice.
See, I felt like there was something else I was going to say, but I forgot what it was.
That's okay. So I think it's great in your interviews, people are referring to something that they appreciated. Are you, and yeah, so how is that affecting how you're thinking about your own project?
For me, I don't know about my colleagues yet. I really want to talk to them about this. It makes
Yep.
me think that our approach has to be a lot different than what we expected. Instead of creating a program to link to peer support services, maybe it's a program that um, improves services that support people in other ways, like creating systems where you have activities that you do outside of your normal groups that offer you support in a different setting, even like a game night or something social that
100%.
people can do that's not centered around alcohol, which is pretty much
Right.
the extracurricular activities in our area. It's the bar, hiking. There's not much in between,
Yep.
um, and a lot of people too in our interviews, especially the long-term recovery people, mention like a lot of people have kids and they want to they can't do these things because they don't have anybody to watch their children, but if they had family activities that they could go to, it would be good for the kids and it would be good for their recovery, and it would just be a more supportive environment. So I loved hearing about that. I'm like, oh yeah, we need to support your life in the outside world, create this new way for you to I don't know, or recreate your life, get away from the old habits that
That's
you
right.
had.
Establish new habits. That's right. Um, well, that's a huge insight. It was, I'm just reflecting on it a little bit that it was given to you by, one of the people who have been in recovery before. They've pointed to it and then talked about why it was so valuable. So this is a huge insight for your project. Now, that doesn't mean the solution is easy, right? Because it's very different than what you guys have been thinking about necessarily. And how you create an environment of those activities doesn't mean that you guys have to do it all, right? This is where creativity and the solution making that's coming up will play such a role, and looking for other analogs of how things work, or analogs of how other people have solved problems or created activities in a community, and they weren't the primary funder necessarily or organizer. So that's fantastic. Great. So very helpful. Can you say something a little bit about maybe how the Catalyst learning or program or the kinds of things we're trying to teach, how that's been with the team, and are you guys learning it? Has anything stood out from the experience so far?
I think the main thing for me, and I think well, with the whole team, is the concept of the interviews and asking those open-ended questions to to get away from what we think we know has been the biggest thing.
Uh-huh.
It's completely changed our perspective on what we're dealing with. Like we had so many expectations that are not at all what we're learning, and I think that's the biggest thing that stands out to me.
Nice.
Um, yeah, as far as the whole Catalyst process goes.
Nice. And you have experience with motivational interviewing, right?
Yes,
Yeah.
yes, and we all do, and
You all do.
that's something we're trained on initially when we start here, and it's really helpful with all of our clients. But yeah, particularly in this way, it was
Right? There's something a little bit different than how that gets
yeah,
implemented institutionally or organizationally, and then this whole notion of bringing people into the open-ended problem solving of and understanding of the current situation. Yeah, I think you're really.
it's
Go ahead.
It's very interesting because you can't really, sometimes when we're doing motivational interviewing, we're kind of leading them, in certain directions. And with this, you can't do that. You have to really step back and say, okay, tell me about this and tell me whatever you're willing to tell me and just absorb everything that they've said. Um, so it takes
Nice.
a little bit of restraint in some ways, but it's been amazing. We've had some just really touching stories from the people that we've talked to. Some uh, great insights on what their experiences have been, especially the people in recovery. It's been amazing.
Fantastic. Yeah, you articulated that really well. That lots of techniques are leading. You still maintain that sense of where you're going and you're leading them there, or you know what's going on. And as you said, this is completely opposite. It's just take in everything they have to say about the situation. So I really commend you for your self-awareness in that and kind of the insight about that. That's awesome. What's been the biggest challenge for you guys?
Time. I think time. We're all, like everybody, we're pulled in so many different directions. So having the time to talk to each other about what's going on, even though we have all these things to link us together, it's hard to find the time to do it all.
Yeah.
Yeah, that's been the biggest thing. Other than that, everybody that we've reached out to interview has been really into the whole process. They've been excited about it.
In terms of
Yeah,
the people
it's just,
you're interviewing?
yes. Yeah, so far, we're looking at people in recovery, active users, professionals in the treatment realm, and loved ones of people in recovery or actively
Beautiful.
using.
Yeah.
So far, we've done active user interviews and people in long-term recovery. We're still working on the other side,
Uh-huh.
but
Uh-huh.
they've been very excited about it. They're always, or so far, they've been really happy to share their stories. I hear a lot of you have to give it away to keep it, which means that it helps them in their recovery to talk about their story,
Awesome.
to talk about their journey, and I love hearing it.
Uh-huh.
It's
Yeah.
inspirational.
It's really rewarding work, right?
Yeah,
Yeah.
it absolutely is.
Yeah.
Um,
How did you recruit them? Maybe a last question. And then if anybody has questions for Joanne about their project, feel free to pop them in the chat. I don't see anything coming through. Once again, everybody's captivated by what you're sharing. But yeah, how did you recruit
um,
the individuals?
we did a couple of things. We did a live stream video on our Facebook page and shared it on
Nice.
our local like town Facebook page that shares things,
Uh-huh.
sells things, stuff like that.
Yeah.
Kind of like a marketplace.
Yeah.
We also went on the radio to announce what we were doing, and it was
Okay.
the radio created a live stream like this as well, so that
Yeah.
we could share that video after the fact. We also called people because we knew them and just asked them if they'd be willing to participate.
Fantastic.
Um,
Like, I'm blown away by that kind of outreach, but that's exactly what you should be doing, right? Uh, it's the kinds of things we would do as longtime practitioners. We're as opportunistic, scrappy as we could be, and doing something on Facebook, doing something on radio, that's fantastic. Maybe in a smaller community, all those things are easier to access, but those are
mhm.
great ways to reach out to the community and to get, even if somebody didn't respond or they're hearing it, right? And so you're laying the seeds for maybe attracting participants in the future once you have more to
And
say about what you're doing. Yeah, go ahead.
absolutely. Oh, I was going to say word of mouth is huge here. So um, through the work that we do, I know a number of active users. So one of them I have a great relationship with. I talked to her and she's like, "Oh, I know somebody else. I'll see if they want to talk to you." And then that person gets that person very excited about it, and it just kind of uh, snowballs from there. So
That's right. Nice.
it's been great.
I love it. Kathleen has a quick question here. Are you interviewing in person or virtually?
Oh, both. So we've done both in person and Zoom. Um, Zoom for the people that's they're more comfortable with that, and in person for the people that either can't don't have access to Zoom, or
Yeah.
I just need to go where they are.
Yeah.
Um,
Nice. Good for you guys. That's
we're
just
also telling people like we'd be happy to do it over the phone, but we kind of like that face-to-face conversation. It feels like it adds more to it.
yeah. You can make a stronger connection with them. You can open up and be more empathetic with them in face to face for sure. Yeah. Fantastic. And Kathleen thinks it's super cool that you're on the radio.
The radio.
Right? I've always wondered about that. I think, you know, I think we can just call up the radio station and say, hey, how can we get a spot or PSA or something? And you work with them, right? But you guys clearly, yeah, good.
We have a monthly spot with them.
You have a monthly spot with them. Nice.
Yeah.
And you highlight something about health in the community or one of your programs or?
Yeah, we highlight our programs, what's going on, in the next month. Just try to talk about whatever we're doing or whatever we're trying to do. Just to keep our name out there too, so people keep hearing about us.
Nice.
Um,
So we know you haven't solved the problem yet, but Maria Elena is already asking, how likely do you think this program can be successful in other regions? So she's clearly thinking you're on your way to success.
I hope we are. I'm not sure what our program is yet, but I hope that we will create something successful and something that can be successful in other places too.
Yeah. Well, tomorrow you'll have a chance to work with your team a little bit on synthesis, and I think you're bringing some great momentum into tomorrow's meeting to talk either about a journey map, because I can imagine a journey map for somebody in recovery being much different than just the journey they go through with you in your facility, right? Or in your program, or the things you kind of the way you used to think about it. Like, what if you imagined really a recovery journey, maybe even a global one of 2, 5, 10 years, to where it starts as a journey and ends up being, a full life once you're in recovery, you're always in recovery. And how does that transform their lives? Like, that would be an awesome thing to synthesize after hearing all these very meaningful stories from the people you've talked to. So,
Absolutely.
yeah. So thank you so much for joining us. We're about 6 minutes past the half hour. I really appreciate it. It was short notice for Joanne. Micheline, who's also on the team, who's done some interviews, she's taken her kids to the dentist today, so she couldn't be with us. But thank you so much for joining and sharing your experience. I really appreciate it.
Thank you, Chris.
All right. Talk to you soon. See you tomorrow.
Okay, bye-bye. See you tomorrow.